Hi, and welcome to our webcast. I'm Dr. David Marks. Colon cancer is the second leading cause of cancer death in the U.S., but you often don't get symptoms until the cancer's spread. That's why routine screening is so important. Here to talk about colon cancer screening and who should get it are two experts. First is Dr. John McDonald. He's an oncologist at St. Vincent's Comprehensive Cancer Center in New York City. Welcome.
Glad to be here. Thank you.
And next to him is Dr. Mark Pochapin. He is a gastroenterologist at the Weill Cornell Medical College. Welcome.
Thanks, Dave.
Why is screening so important?
Well, obviously with any cancer, it has to start somewhere. It starts in a relatively localized fashion, and if you detect and treat the disease when it's localized, you essentially can cure any cancer. If you wait until the disease has disseminated, has metastasized, it becomes very difficult to cure patients. So screening with the detection of early curable disease is a very important aspect of all cancer, and it's a very important aspect of colon cancer, which is a really common disease in the United States.
What are the different ways people go about screening?
There are a lot of different ways. They're all not equivalent, though. The most effective and most comprehensive would be a colonoscopy, which is a procedure where a tube is put in the intestine and looks around the entire colon. That's also the most invasive, and it's done with sedation, so a patient is relatively sleepy or asleep. Then there's a sigmoidoscopy, which is a much smaller version of that, where it's just the bottom of the colon that they're looking at. And that's usually combined with fecal occult blood testing, which is the little card that doctors or nurses use to see if there's any occult or microscopic blood in the stool. And then there's a barium enema, which is a radiographic or an X-ray test. And finally, there's a new kid on the block known as virtual colonoscopy, which is really a fancy three-dimensional CAT scan, which still requires the same preparation as colonoscopy, but it's an indirect or an X-ray measurement of the internal view of the colon.
How is a person supposed to choose which one of these screening methods is right for them?
With good advice. It's obviously the patient can't really choose which is the appropriate method for them. Many people feel nowadays that if a patient can tolerate a colonoscopy, which most people can, that's the best approach for several reasons. And one is that when you do a colonoscopy and you find that the colon is entirely normal, no polyps, no abnormalities, that has been shown to very substantially decrease the risk of death from colon cancer in the next 7 to 10 years. So it's a very good screening test. And two is if you find an abnormality with colonoscopy, the colonoscopist, the gastroenterologist, can do something. Can remove a biopsy if it's a tumor, can actually remove a polyp in toto. So it's a useful procedure, both diagnostically and therapeutically.
Of course, a lot of insurance companies won't pay for routine screening colonoscopies.
That's true. It's a real problem. Actually, Medicare now is just recently in the process of trying to approve, or actually may have approved a bill to look specifically at patients for screening colonoscopy over the age of 50. I think that may just approve one. But certain insurances are coming around noticing that if you find a polyp and remove it and prevent the cancer, that's actually cost effective in the sense that a patient will not develop cancer and all the costs and all the morbidity associated with that. So in the long run, actually one single colonoscopy may be way more cost effective than allowing people the chance or the risk of developing cancer.
How old should a person be when they start worrying about colon cancer and they start screening for this problem?
Well, it depends. If you look at the average population in the United States, people who don't have a particular family history of colon cancer, don't have a personal history of polyps or colon cancer, then most people would say at the age of 50 is important to do that. Now, if you have a family history, if you have had polyps in the past at a younger age, then you should start sooner. And again, the advice of an experienced gastroenterologist is really very important in regard to this, and not only for you, but for your family when you would want them to start screening.
Is there a difference for men and women?
Actually not. There's a real myth out there. Some people think of colon cancer as a male disease, and that's completely false. It affects equally men and women.
How often should a person be screened once they start the process? What are the current recommendations?
That's a good question. The current recommendations are for colonoscopy once every 10 years. Well, that's really based not so much on clinical data, but more on theoretic data. And so that's being studied right now. If someone is found to have a polyp on colonoscopy, then every 3 years after the polyp is removed to prevent and make sure that new polyps are found and removed. And then things like barium enema, the recommendation is 5 years, although it's unclear whether that's really accurate as well. And I think the most important thing is that people speak to their doctors every year and discuss what the appropriate screening regimen is, because it's different for everybody in different family histories.
What are some of the reasons that people don't get screened?
Colonoscopy.
Scared of it?
Yeah, absolutely. I mean, and it's the same with why don't people get their blood pressure checked regularly? Why don't they get prostate exams regularly? Or why don't women get pap smears? There's a sort of a natural inertia of the healthy to screening procedures, and I think when one can make screening an important part of ongoing health care, then people tend to do it. And also, if it can be made relatively simple. And for me, a non-gastroenterologist, one of the things that's attractive about colonoscopy as opposed to a yearly rectal examination, yearly stool for occult blood, sigmoidoscopy every 3 years, is that you have a procedure that can be done with the patient being relatively comfortable under sedation, and can be done maybe once every 5 years maximum, most people.
Okay, we'll leave it at that. Thank you both very much for talking about screening. Thank you for joining our webcast. I'm Dr. David Marks. Goodbye.